Hi, welcome. Thanks for coming back. Tell us your name and what the problem was that you came to see us here at Southern Stem Cell Institute.
My name is Alessandra Carter. I came to the Institute back in March. I had been an avid exerciser and daily Ashtanga yoga practitioner, and I tore my ACL in the gym and really thought there was no hope but surgery.
And so what did you do that you tore it in the gym? What kind of activity were you doing?
I was doing squats using weights, and the angle that I turned caused the tear. And I think from the years of yoga, I had some hypermobility, and the combination was the perfect storm.
Wow. And did you go see an orthopedic surgeon or a doctor about it before you came to see us?
I did. I went to see an orthopedic surgeon that had been highly recommended, and they immediately were able to pinpoint the problem and suggested surgery. And so I took the advice to heart and went home and thought about it, and I think I knew there were some other options I wanted to explore, or at least other people I wanted to speak to, and I was lucky enough to meet you at the time.
Great, great. So tell me, before you came to see us, before your treatment, what were you able to do with your knee? Like when you had the tear, did you have to use a brace or crutches, or how are you getting around? Were you limping?
Yeah, I absolutely needed the brace. There just wasn't stability. It felt like there was a ball on top of a pole, and at any moment it could fall off. And it was a very vulnerable sort of place to be when you're walking or trying to go to work or turning or any of those things. So a brace was really necessary, and even with the brace, there was still some instability.
Wow, okay. So you weren't able to do any of your normal activities either. You weren't able to, walking was a chore probably, right?
Absolutely.
No running, no
exercise.
No sports, none of those things
Yeah,
you were able to do.
yeah.
Weren't able to climb a bunch of stairs.
No.
Wow, okay.
And then in the evenings, there was some pain experienced also, even at the end of the day when the brace was off, and a little bit of throbbing around the area.
Wow.
Yeah.
On a scale of 1 to 10, what do you think your pain level was?
The initial pain level was a 10.
Wow.
It was a very painful tear. I think weeks after the walking and during the day, it was a dull ache. So it was always at about a 5 or a 6.
Wow.
Yeah.
Okay. So you came to see us. You got treated. Tell us your journey. When did you start feeling better, and how do you feel now?
Yeah. As you know, I was full of questions. Not so much skeptical as I like to be informed about the treatments that I engage in, and you had shared with me that it might take 3 months to feel some effect, and then it would continue after that. And I think I thought that I would feel it overnight immediately, and in the beginning, it does take being patient and reminding yourself that there's a time frame of healing here. So I did have to remind myself of that, and then around the 3-month mark, I definitely started to feel it, and I'd say about the 5-month mark, I felt a noticeable difference, and so it was really encouraging. And now we're at about 9 months, and I'm able to engage in my yoga practice again, and just starting to get back into my exercise program and feel like myself again. So it's
wow.
It's
So
been
what's your
amazing.
pain level now? So you started out at a 10, and then some days were a 5 or 6 just with casual walking. Where are you at now?
I would say a 0. I really don't experience any pain unless I do something, significant that I may have, had pain before. I feel like that it has healed.
So Alessandra, can you show us what your movement was like before you got your treatment and what it's like now?
Sure. Before I got the treatment, I was able to move forward. I wasn't able to do a lot of bending, but as long as I kept the legs straight and was very tuned in to keeping that angle, I didn't experience too much pain, but I did notice that when I needed to cross the street quickly or do anything quickly, I wasn't able to. And I certainly wasn't able to engage in my yoga practice, which caused a lot of sort of right angles and movements where the knee isn't aligned perfectly, and also any type of warrior pose was out of the question. So that I've gained full mobility.
Can you bend your knees now?
Absolutely.
Yeah.
I can bend them.
That's wonderful. So you can
Yeah.
jump up and down.
Yeah,
and
I mean,
move.
just
Yeah.
complete,
Awesome.
yeah, complete mobility.
No problem walking, and you're actually running now too, right?
I've started my running program back, so I
That's
feel like
awesome.
I'm beginning to be myself again.
Yeah. Awesome.
Yeah.